This is the $1.6 billion system failure, anatomy of the Change Healthcare security breach. Prepare for an urgent professional breakdown. On February 21, 2024, the digital nervous system of the American healthcare industry suffered a critical system failure. Change Healthcare, a subsidiary of United Health Group, went dark. This was breaking news. This wasn't just a server outage. It was a cessation of payment processing for hospitals and pharmacies nationwide. The financial fallout from this incident has been monumental. Let's look at the numbers. The initial cost impact for the first quarter alone was approximately $872 million, according to the United Health Group Q1 report. The total fallout is projected to exceed $1.6 billion for the fiscal year, based on the United Health Group 8K filing. But we aren't here to discuss the financial loss. We are here to discuss the architectural mechanism that allowed this to happen. The system was dismantled by a known threat actor, ALPHV, also known as BlackCat. This group managed to dismantle a system vital to national security. What was the single architectural oversight that led to this catastrophic breach? The breakdown was not due to a quantum decryption or a zero-day exploit in the kernel. It came down to something far simpler. The failure point was a single architectural oversight on a legacy perimeter. One portal, valid credentials. And the fatal flaw? A complete absence of multi-factor authentication, confirmed by the United Health Group CEO testimony. This is a forensic autopsy of how the largest healthcare clearinghouse in the US was brought to its knees. It was brought down by basic credential stuffing, a threat everyone should be protected against. This underscores why M&A integration is currently the highest risk vector in enterprise architecture. To understand the eventual failure, we must first truly respect the scale of the target. High-volume data networks are the digital infrastructure that keeps our modern world moving, much like the relentless flow of traffic you see here. Change Healthcare is not a simple consumer app. It is the fundamental switchboard for the US medical economy. The sheer volume of data this system handles is difficult to grasp. Before the blackout, this system processed approximately 15 billion transactions annually. That's a relentless and non-stop flow of critical data. Furthermore, this massive network touches 1 in every 3 US patient records, highlighting its immense nationwide impact. In 2022, a major event amplified the infrastructure challenge, a critical merger. United Health Group completed its acquisition of Change Healthcare in 2022. This integration created immediate complexities. The result was a massive, heterogeneous environment. United Health's modernized, hardened Optum infrastructure, alongside Change Healthcare's legacy sprawl of data centers and acquired, older tech stacks. The stakes involved with this system are absolute, demanding the highest level of availability. This network handles eligibility checks, pharmacy claims processing, and provider payments. These are essential functions for life-saving care. High availability here is not just an industry standard, it is an ethical requirement. If this system goes down, patients are directly harmed by being unable to pick up essential prescriptions. Despite the critical nature of its operations, the underlying architecture harbored a significant weakness. The architecture relied on a trusted perimeter model, designed to be hard on the outside and soft on the inside, assuming once you were in, you were safe. But as we will soon see, the hard outside perimeter had a door that was tragically left unlocked. This combination of immense scale, complexity, and a known architectural weakness foreshadowed the catastrophic failure to come. We've established the monumental scale and complexity of the target, which set the stage for one of the most impactful cyber incidents in history. Let's first visualize the network topology. The specific entry point for the attack was identified as a Citrix remote access portal. In a standard enterprise architecture, a remote access gateway acts as the primary airlock between the public internet and the internal corporate network, or LAN. This airlock is designed to be the first layer of defense, essentially a perimeter firewall protecting internal resources. Typically, this airlock is secured by an identity provider, or IDP, which enforces a crucial zero-trust policy. Never trust, always verify. You are required to authenticate, provide a second factor of authentication, and even then, access is strictly limited. The secure process further segments you into a specific virtual local area network, or VLAN, minimizing your initial access scope. However, the attack exploited a significant deviation from this standard, exposing critical flaws. This specific Citrix portal was a legacy artifact, an older system that had not been fully modernized. It had not yet been fully migrated to the organization's standard identity governance controls, leaving it critically exposed. The architecture failed in two distinct, yet interconnected layers. The first failure was the identity layer. The portal allowed access with only a username and password, completely bypassing multi-factor authentication. The second failure was the segmentation layer. Once inside, the user context presumably had broad read-write privileges, allowing the attacker to reach critical domain controllers. This scenario demonstrates a classic eggshell security model, a hard external shell with a soft, undefended interior. The attackers didn't need to break the wall. They just walked through the only door that lacked a deadbolt. This lapse immediately exposed the internal network, allowing lateral movement and access to sensitive systems. The official trigger event was recorded in February, but the ground had been laid long before the alarms were set to sound. The entire compromise likely began much earlier through credential harvesting, the silent first step in gaining access. The threat actor was identified as an affiliate of the notorious ALPHV, or BlackCat, ransomware as a service group. The attacker's goal was simple: initial access. They succeeded in obtaining valid credentials necessary to bypass the front door. The exact method of credential theft is unknown, but analysts report such groups often utilize stolen logs or through phishing. On February 12th, the attackers used these stolen credentials to log directly into the Citrix portal, establishing their foothold. This login marked the first domino, the critical moment when the legitimate credentials allowed the attacker to step inside the perimeter. Crucially, there was no multi-factor authentication or MFA enforced. This allowed the login to succeed without a challenge from an unrecognized device. At this point, the attackers were officially inside the network perimeter. They had access, but the file encryption had not yet begun. They immediately moved into the reconnaissance phase, known as living off the land, blending into normal network traffic. Their priority was to map the network, scanning for Active Directory domain controllers and understanding the environment. The threat actors were actively looking for sensitive data repositories, preparing for the most damaging phase of the attack. This period of 9 days, known as the dwell time, was the critical window of opportunity to detect the breach. For 9 days, the attackers operated inside the network, patiently escalating their privileges and preparing their payload. The entire 9-day period was dedicated to reconnaissance and preparation for the exfiltration and subsequent file encryption. Why was the breach not stopped during this critical dwell time? This is where the legitimate credentials caused the greatest problem. The use of legitimate credentials masked the malicious activity, making it appear as routine administrative work. This critical window was when intrusion detection systems should have fired, but the legitimate credentials allowed the attackers to operate undetected. Once the attackers secured domain admin privileges, or a functional equivalent, the cascade accelerated. They didn't just lock the data, they stole it. Exfiltration logs suggest approximately 6 terabytes of data were moved out of the network. The second major phase was the detonation of the encryption payload, marking the switch from surveillance to destruction. Then, on February 21st, the attackers detonated the encryption payload across critical systems. The ransomware locked critical database servers and transaction processing engines, effectively paralyzing core business functions. Faced with an unprecedented threat, United Health Group was forced to make a drastic decision. When United Health Group detected the widespread encryption, they knew they had to act immediately to contain the damage. To prevent the malware from spreading to the wider United Health and Optum networks, they physically and logically severed the connections to the infected system. But this safety measure led to an unintended consequence, a reliability paradox where the cure became part of the chaos. The safety mechanism, disconnecting the infected limb, ironically caused the systemic business outage across the entire ecosystem. Pharmacies attempted to route critical claims and hit a black hole. With the processing engine severed, the system could not function. Furthermore, the assumed redundancy systems failed precisely when they were needed most. The failover systems were either already compromised or were critically dependent on the same severed infrastructure to operate. The dependency graph was much tighter than assumed. When the main system went dark, the redundancy failed because the clean backup environment was essentially cut off to preserve its integrity. Diagnosing this failure requires us to look past the ransomware. The surface attack is merely a symptom. The root cause is not hackers. The root cause is M&A technical debt. This is a common yet dangerous byproduct of corporate mergers and acquisitions. When two companies merge, a dangerous time window opens, the risk window. This is the period where legal ownership outpaces technical control, creating a perfect environment for exploitation. The risk window exists between the legal closing of the deal and the technical unification of the IT stacks. During this window, you own the asset, but you often don't control the security visibility or policy enforcement across the newly acquired network. We see a prime example of this technical debt in the Change Healthcare incident. Change Healthcare was a massive acquisition, integrating complex systems into a single entity. The migration of thousands of servers to UHG's hardened standards was in progress, but critically incomplete. The forensics failure lies in a fundamental prioritization error made during this integration phase. The core failure here was the prioritization of business continuity over rigorous security hygiene during integration. Leaving a legacy Citrix portal active without multi-factor authentication is a known violation of modern security standards like NIST 800-63B. Based on our analysis, the diagnosis is clear. The system design itself failed to enforce essential modern security principles. The system design failed to enforce the principle of least privilege, granting too much access by default to users or systems. Furthermore, it failed to enforce zero-trust verification at the network edge, allowing unverified access where strict checks should have been mandatory. The attackers exploited the critical gap between legacy policy, the old system's configuration, and corporate policy, the new desired security standards. This serves as a crucial reminder. In the digital landscape, the deepest failures are often rooted in policy and architecture, not just technology. So what is the verdict for the senior engineer? We have two key findings. First, identity is the new perimeter. This changes everything about how we secure our organizations. Firewalls become irrelevant if the identity provider is weak. Attackers will bypass network defenses entirely by simply stealing credentials. If you do not have multi-factor authentication, or MFA, on every single external entry point, you do not have a perimeter. Instead of a secure perimeter, you simply have a welcome mat for adversaries. Unauthorized access is inevitable without this fundamental layer of defense. Second, we introduce the M&A quarantine rule for organizational growth. If you acquire a company, you must assume their network is already compromised. This is a critical risk mitigation strategy. Do not bridge their network to yours until every entry point meets your security baseline. Patience is a security virtue here. Treat acquired infrastructure as hostile internet until proven otherwise. This is the only safe default position. Now, for the overarching principle of this entire lesson. The maxim for this episode is this: complexity is the sanctuary of the adversary. The more complex your legacy footprint, the more shadows there are for attackers to hide in. Eliminate unnecessary complexity. Simplification and standardization are not just operational goals, they are fundamental security mandates. To conclude this verdict on the state of your security, do not let a 20-year-old unpatched portal destroy a billion-dollar reputation. Your oldest systems are often your greatest risk. Implement these findings for a stronger, simpler, and more secure future. The verdict is delivered.